All right, let's dive into a topic that, well, it affects every single one of us. Disease. Think of this as your quick and clear study guide. We're going to break down all the essentials.
You know that feeling, right? When you're just off, totally knocked out of your usual routine. But have you ever stopped to wonder what is actually going on inside your body when you get sick? It's something we all go through, and getting a handle on it, that's really the first step to taking charge of your own health.
Okay, so let's treat this like your own personal super fast study session. We're going to break down the science of disease, step by step, starting right at the beginning.
And you know, any good study guide has to start with the basics. So, first up, vocabulary. Let's get our key term defined.
Okay, I know the official definition can sound a little, well, clinical, but it's a really important place to start. A disease is basically any abnormal condition that messes with the structure or function of your body. And that's a huge umbrella, right? It covers everything from a simple cold all the way to a serious long-term illness.
So, let's simplify that. At its core, disease is just a disruption. I mean, think about it. Your body is like this incredibly complex machine, right? All these different systems are supposed to be working together perfectly. A disease is just something that throws a wrench in the works and causes a part to malfunction. That's really the big idea.
All right, with that definition down, let's move on to our next chapter, how we classify diseases. To really get the full picture, you've got to know how scientists and doctors group them. And it really boils down to two main types.
So here's the big divide. On one hand, you've got your infectious diseases. These are caused by outside invaders. Think bacteria, viruses, that kind of thing. They're the ones you can catch from someone else. And on the other hand, you've got non-infectious diseases. These aren't caused by germs you pick up, and you can't spread them. They usually come from a mix of things like your genes and your lifestyle, often over a much longer time.
Let's put some names to these categories so it's not so abstract. We're all very familiar with infectious ones like COVID-19 or the flu. They can just tear through a population. Then you have the non-infectious heavy hitters, like heart disease or diabetes. These are huge health issues for sure, but you're not going to catch them from sitting next to someone. The key thing to remember is that difference in where they come from and how, or if, they spread.
Okay, so knowing all this naturally leads to the next big question. It's one thing to know what a disease is and how it's classified, but what do we do about it? How do we fight back? This brings us to our next section, strategy.
And honestly, this is the most empowering part of the whole guide. This is where we turn what we know into what we do. So don't think of this as just a boring list of tips. No way. This is your personal prevention playbook.
So what's in the playbook? It really comes down to 4 key moves. Step 1, a balanced diet and exercise. This is your foundation. It builds a strong body. Step 2, hygiene and hand washing. So simple, right? But it's a powerful shield against those infectious germs. Then you've got step 3, vaccinations. Think of these as a boot camp for your immune system, teaching it how to fight off invaders before you even get sick. And finally, step 4, regular checkups. These are absolutely critical for catching things early, especially those non-infectious diseases.
Okay, for our final chapter in this study guide, let's look forward. Let's talk about the incredible progress we've made. Because look, when prevention isn't enough, we now have this amazing, constantly growing arsenal of medical tools to help.
I mean, just look at this timeline. It's pretty incredible when you see it laid out. We go from the accidental discovery of penicillin back in 1928, all the way to the super fast development of mRNA vaccines in 2020. The speed of innovation is just staggering. And every single one of these breakthroughs, it saved millions and millions of lives and completely changed how we deal with disease.
So the big message here is really one of hope. We're living in a time of just mind-blowing scientific progress. And yeah, there are always going to be new challenges, but our ability to understand, to fight, and to manage disease is better than it has ever been in human history.
And that really brings us full circle to this quote. I think it just perfectly sums up everything we've talked about. Of course, all those medical tools are incredible, but the real goal? It's using knowledge, exactly what we've been going over, to stop people from getting sick to begin with.
So that's our study session. We've hit the what, the how, and the why of disease. All of that knowledge is now yours. It's a powerful tool, not just for you, but for the people you care about. So the only question left is, what are you going to do with it?